Hello everyone. So today we are going to talk about the medication errors, and this is a continuation of patient safety series. Here we are going to touch on two topics. One is how human factors, and the second one is complacency. These two factors can really lead into medication error and ultimately causing patient safety issues. So let's just start with an example. So here we have a newborn infant who has cardiac failure and is managed in the neonatal intensive care. The pediatric cardiology suggested to start IV propranolol, of course, for better cardiac function and to control the cardiac failure. The busy team of trainees placed the order in the electronic health record, but instead of ordering propranolol, they ordered propofol because the name sounds similar and it was not really spelled out the way it should be. Anyway, we'll talk about these in the errors. So the order was processed and dispensed because at the pharmacy, and unfortunately they don't know the clinical condition. They just saw the order and it was an urgent scenario. They send the vial up, but due to the color of the vial, as you guys know, that propofol is whitish milky solution, which is not something very routine. The error was detected and the medication was sent back to the pharmacy. So one thing you noted, that how two similar sounding drugs could lead to an error. Propofol, propanol is if you pronounce it in a different way, we all have accent, so it could be mistaken one over other, and especially in the ICU setup. Of course, if it's you're working in the clinic, this doesn't apply much, but in an intensive care where the patient is being managed, with the cardiac failure, people could think of that, they need propofol, maybe they're intubating the baby instead of propofol, instead of propanol. See, I even did that. So how common is that? So just have to be careful about it. So anyway, let's walk through and see. First of all, what do you guys think? What type of error was this, or what type of problem was this? Near miss? Was this adverse reaction? And sentinel event? It's very easy. It was near miss because we picked it up before the damage is done. If unfortunately propofol was given and baby become apneic, that becomes adverse reaction, and god forbid something else happened, then it will become sentinel event. So just make sure whatever we do in our clinical practice have some consequences. So we have to be very, very careful with patient safety, and especially we should try to prevent the errors. So I'm going to follow this nice pyramid present. I have adopted it from the National Association of Healthcare Quality. So let's walk through each step in this question and see what we could have done. So again, the same example here, same question. So in this question, let's first see what we could have done at different stages. So eliminate the opportunity of error. So what was the opportunity here? That, first of all, the difference between propofol and propranolol has to be spelled out. It should be said very clearly. Make it hard to order wrong things. So one thing we can do is, like, EHR can give you the indication that you're ordering propofol, do you need it, and make easy to write the right thing. And of course, to the right thing, same token, that the EHR should help doing that, and make the error visible. Again, with the clinical decision support and AI, the pharmacy built-in orders could give you some signs that this order, do you really need it, or some sort of indication and all. And then of course, once you have to minimize the consequences of error. So this one is a medication example, but suppose the timeout is not done for a procedure, that you can you have to do that. And the last one is, of course, we all have to learn, and we have to change our policies, tailor our training and inspection as needed. So now let's see how we apply these in this scenario. So here one could have asked, that propofol is an anesthetic agent. Do you really need in this newborn baby? Because propofol is not a routine medication we use in NICU. A picture pop-up is a good option. That a picture of propofol, or the generic whatever, should pop up, or indication should pop up at a side window. And if a similar drug, the computer program can spell it out for you. Do you really mean that? Then of course, rechecking at every level. If you guys remember a Swiss cheese model as described in patient safety, that you have to have all the holes in line to get the error. Unfortunately, in this case it happened. Fortunately, it was caught. And of course, we all need training, and in this case is a real example that here we have to train the whole staff about that this error should not have happened or should not happen again. So let's see, like we said, we'll talk about two things, which is one is the human factors that are involved in patient safety errors, and the second one is complacency. So let's talk about that. So this is, the Federal Aviation follow, and they said this dirty dozen. So as you guys can see, 4 important factors out of this 12 is stress, distraction, communication, and then the teamwork. So for example, in this case, as we noticed that, this baby ultimately got intubated, and it's in the NICU, very stressful environment. Everybody was busy, the team was busy, the patient is in failure, pediatric cardiology at the bedside. So it was a very stressful scenario, and there's a lot of distractions happening, and so because of that, unfortunately, this was done. So how can we mitigate that? First of all, we all have to be calm in an ICU setup, and communication is the key. I think communication. I always try to follow. If I write an order, I go to the nursing, at the bedside and communicate. Even if it's an order of feeding, I communicate, because errors can happen. So please do communicate. Electronic record or electronic ordering should not replace talking to people or talking to your staff and talking to each other. Please remember that if you could take one message from this slide, is that communicate all your plan of action at the bedside. So now let's move on to the other problem which we see in practice is complacency. So what is complacency? It's a feeling of self-satisfaction. So sometimes I see, like in this case, the chief resident wrote the order. So the senior we become, unfortunately, we have this built in our human factor that we know it all. So so this is the problem, that we stop seeing and seeking help. So we are self-satisfied, we are blind to certain tasks because that become our second nature, or I write the order all the time. There is denial, refusing for doing something, and then of course ultimately they collapse. So how to avoid that? And this is very important. So remember that whenever you come to work, see that it's honestly, start every day from scratch. Just even if you have to write an order, just treat yourself as a student rather than the professor. Surround yourself with people who tell you, that this is it. You should not be with the people they always praise you and don't find mistakes in you. Then always focus on the process, not on the outcome. This is another thing, unfortunately, we see whenever a bad outcome happens in any institution. The first question people ask, who was on call, who wrote the order, who did. This is not really important to penalize people. The important to see the process. That's how we improve. That why it happened rather than who did it. So this is very important. Next one is that continuously learn and adopt. We are in a profession where we have to unlearn, relearn, and then this cycle has to go on. And of course, take appropriate rest. Work-life balance is very, very important, as we have seen in this one, that it happened in the late hour of the shift, and the shift was very tired, and unfortunately we have a very small window of error because we work with patients. So again, it's very important to recharge your batteries and get some rest in between. And this has become the part of training now, that we are focusing on wellness of all the staff, because that is very important. So again, to conclude, basically, how to mitigate medication errors. Basically, we all know the right drug and right dose. This is very important. Like in this case, 2 similar drugs, similar sounding drug, unfortunately, one was chosen over the other. Then one important thing, I think, with the development of AI and electronic charting, that decision support, clinical decision support has to be more strong. More windows should pop up. I know it's annoying, and sometimes people get alert fatigue, but again, this is very, very important, that the system gives you an alert that this is really what you want, and then you can just override it if needed. And most of the programs do that. Really, I'm very thankful to most of the EHRs. They have a very nice built-in clinical support. They ask sometime to double sign it, sometime to override it, just to make sure that you're not making a mistake by choosing the wrong drug or wrong dose or wrong frequency. And the key, which I already talked about in my previous slide, is communicate. Please do communicate whatever you are doing in any clinical setup. Don't assume that people know what you really want. You have to communicate, and especially when you're working in intensive care unit. And of course, importance is, avoid pressure, avoid stress, distraction, and fatigue. Unfortunately, sometimes it's very difficult because sometimes things happen at the end of the shift and one is almost running 12th hour of the 12-hour shift. So fatigue just happens, and sometimes the case is so that there is a lot of pressure and stress, and in that mistakes can happen. And of course, the most important thing is reduce the complacency. So don't assume that, because I'm doing it, I'm the best, I know it all. No, please question your skills, question your performances, and keep on improving it, unlearning, learning new things. That is the way to go. So I hope this small presentation will help you understanding how important it is to focus on patient safety and avoid medication error. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.